young nurses just not even knowing how they're going to cope. Like, it's heart-wrenching.
We suspect there'll be many healthcare workers who become ill over the next few weeks and won't be there to care for patients.
Hospitals need help. That's the message from BC doctors and nurses as staff are falling ill and healthcare workers are being asked to work overtime upon overtime to keep up with the need.
One nurse today, it's like she said the fourth wave crushed me. And I'm like, she's out of school for a year.
Pressure on BC hospitals due to the rapid spread of the COVID-19 Omicron variant is intensifying. The number of people hospitalized with COVID-19 rose again on Wednesday to 317 patients, compared to 298 the day before. Danette Thompson with the BC Nurses Union in tears as she spoke with me, as she sees so many nurses unable to cope with demand.
You feel like literal lives are on the line if you say no to a shift, but how does someone cope with that level of responsibility?
It's so heavy. It's so heavy for our members. Our long-term care nurses are staying double shift, so 16 hours, not because they're being told to, but because there's not another nurse to come in after them.
I don't want people to think that it's getting better, because, we're really just kind of starting into this. We have many weeks to go yet.
Critical care specialist at St. Paul's Hospital, Dr. Delbert Dorscheid, says staff are starting to get sick, likely due to the level of community spread. He says many healthcare workers are canceling any plans for time off in the next few weeks to brace for what's to come.
It's almost impossible to identify some region of the hospital that hasn't been affected by staff shortages at this point. I think a lot of us are quite worried. It's not just that it's a fifth wave, but this one's going to have a totally different dynamic for us.
We are at a pretty critical stage, and we need to do everything we can to make sure that the next few weeks doesn't collapse our healthcare system.
Mike Old with the Hospital Employees Union worries staff are beyond the point of burnout.
Healthcare workers have their limits. They're really, really exhausted. And, I think for a lot of them, the thought of going through a fifth wave of this pandemic is going to be really hard for them.
Thompson says nurses need to see far more support coming from the province.
Nurses are going in. They are doing what they can. They're working copious amounts of overtime. They are covering, there's many empty lines in every hospital, and they are doing what they can to support their colleagues and to care for the patients of this province. But we need to ensure that's happening for them.
In New Westminster, Ashley Burr, City News.